as I enter the room, I have my tray kit and my materials. And then I have a face shield and a face mask for eye protection against secretion and mucus. And then I have my hand sanitizer here. I'm going to do hand hygiene for 20 seconds as I enter the room. Hi, Ms. Angeles. My name is Catherine. I'm going to be your nurse for today, doing your trach care. Now, I understand you're having a hard time communicating today, so we're going to establish a new form of communication, okay? Now, I'm going to ask you a series of questions during the procedure. And if you want to say no, please put your thumbs down. If you want to say yes, please put your thumbs up. And if you're feeling any sort of pain, please raise your hand so I know right away, okay? Okay, so now that it's established, I just want to check your identity and your date of birth. Okay, I'm going to check your wristband. Okay, is your full name Alani Angeles, and is your date of birth March 25th, 2003? Thumbs up, okay, perfect. And I'm just going to double check that with my records. I'm going to scan your wristband. Okay, everything matches. I see that you don't have an allergy wristband, so I just want to double check. Do you have any sort of allergies? Thumbs down? No? Okay, perfect. Okay, I'm just going to start by explaining the procedure for you. So the procedure I'm doing for you today is called a Trach Care, and what I'm going to be doing is going to be suctioning any sort of secretions in your lungs, and then I'm going to be changing your inner cannula for a new one, and then I'm going to be changing the dressing, which is the gauze underneath your faceplate. I'm going to be also checking your skin to make sure that there's no redness, no swelling, no signs of irritation, infection, skin breakdown, or pressure injuries. I'm going to do the same when I remove your trach stabilizer around your neck for a new one. Make sure that the site on your skin is perfectly okay, all right? Do you have any questions for me? Thumbs down? No? Okay, perfect. So I'm just going to do 20 seconds of hand hygiene again. And then I'm going to put on some gloves. And then I'm just going to take your vitals, all right, Miss Angeles? Okay, Miss Angeles, I'm going to take your vitals. Okay, so all your vitals are within normal limits except for your respiratory rate, which is at 26, and your oxygen saturation, which is at 89%. So hopefully after we do some suctioning, that your oxygenation, saturation, and your respiratory level will improve. Okay, so I just want to check if you have any sort of pain today. No pain? Thumbs down? Okay. Are you feeling any sort of shortness of breath? No shortness. Oh, yes, shortness of breath. Okay, thumbs up. I'm just going to take a listen to your lungs, okay, Miss Angeles? Okay, while I check, can you inhale and exhale for me? Inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale. Okay, I took a listen to your lungs, and I do hear some gurgling noises, so you are due for a suctioning. Okay, so, all right, do you have any more questions for me before I move on? No questions? All right. Okay, remove this. I'm going to do hand hygiene. And then I'm going to make sure that everything is available at your bedside. So let's see if your emergency kit is available. So I see that you have two extra trachs, one that is regular size and one that is smaller in case of inflammation in your trachea. Then you have a new inner cannula. You also have an ampu bag connected to 100% oxygenation. Then you have a suction catheter that is connected to a suction canister and is set at a rate of 120 millimeters of mercury. That is correct setting, but for your suction catheter, I'm going to change it today just because I don't know when was the last time it was changed. It's going to get you a brand fresh new one. Okay, other than that, I have the trach kit, and then with my materials, which comes along with an inner cannula, sterile saline, a sterile disposable container, and then a suction catheter. And I also have your trach ties for you, all right? Okay, I'm just going to start by cleaning the table. So I'm going to do 20 seconds of hand hygiene again. Then I'm going to put on some gloves so I can clean the table. Okay, clean the table for 30 seconds. So Miss Angeles, how was your day at the hospital so far? Thumbs up, that's great to hear. And has any family visited you at all today or during the week? Thumbs up, that's great to hear. Okay. I'm almost done finishing up cleaning the table. One more time. Okay, now that the table's clean, I'm gonna let that air dry for about 2 minutes. Okay, I'm gonna close your curtain for some privacy, and then I'm going to have you have the bed raised up to a semi-Fowler's position. But since you already are in that position, we are good to go. I'm gonna remove these gloves, and then I'm gonna do hand hygiene again for 20 seconds. Okay, and then I'm gonna put a new pair on to prepare my kit. Okay, so I have the kit right here. I'm gonna bring it to the table. Oops. Okay, this is still closed, so it should be fine. Okay, so I have a suction catheter here. I'm gonna take this new catheter out. I'm gonna place it with the old one over here. Okay, I'm gonna take this above your head. Dispose of the old one. Okay, it is set at 120. Perfect. We're gonna come back to this later when we are ready for suctioning. I'm gonna test the AmpuBed to make sure it's working. Okay, it's working. Okay, I'm gonna start preparing the rest of the kit. I'm gonna take this out. This is the sterile disposable container. I'm gonna put this right here. I'll put it right here. And then I'm going to open the Trach kit. Dispose of everything I don't need. Dispose of the sterile gloves, the trach tie, and the brush. And then I have this drape. I'm going to hold it at the 1-inch border only. I'm going to drape this over you, Miss Angeles. Okay, and then I have an inner cannula, which I'm going to put in. And I make sure the sterile side, the sterile part is not, does not touch anything else besides the box. Okay, so with that. Okay, I'm going to put some saline inside the kit, the box here, and saline inside the sterile disposable container. Okay. Next thing I'm going to do, I'm going to dispose of my gloves. Do hand hygiene once again, and then we're going to start suctioning you. Okay, Miss Angeles. Put on some gloves. Do you have any questions for me, Miss Angeles? No questions? Perfect. Okay, so before I start suctioning, I'm going to have to hyperoxygenate you so that you have a better time breathing or you don't feel uncomfortable. So first thing, I'm going to remove your O2 device here as I stabilize the faceplate. Put that right there. Then I'm going to hyperoxygenate you twice with this AmpuBed. So I'm going to give you 2 breaths and then have 6 seconds in between. So 2, 3, 4, 5, 6. 2, 3, 4, 5, 6. Okay, let me check your oxygen saturation levels. It was at 89% before, and now it's increased to 94%. We're good to go. Okay, I'm just gonna start getting the suctioning. I'm gonna let go of your faceplate right here. The suctioning. I'm gonna peel back the plastic right here. Okay, and then I'm gonna put my thumb over this as I test the saline, or test the suctioning with the saline. I'm gonna put it my thumb over. Okay, it works. I'm gonna let go here. Okay, Miss Angeles, I'm gonna go in for I'm gonna put the catheter in for 3 seconds, and then you're gonna feel some resistance. You might cough, and I'm gonna go out for 6 seconds. Okay. Okay, 3, 2, 1, 1, 2, 3. Cough, cough, cough. Okay, I'm gonna hold the catheter right here. 1, 2, 3, 4, 5, 6. Perfect. Okay, the plastic didn't touch the inner cannula. Okay, Miss Angeles, I'm going to put your O2 device back on as I stabilize the faceplate. Did you feel any sort of discomfort at all, Miss Angeles? No discomfort? Okay. And let me check your vitals one more time. Okay, so your vitals, I see that it is at 16 at respiratory rate, and it is 94 in O2 saturations. Okay, are you feeling any shortness of breath at all? Thumbs down, no shortness of breath. Okay. Do you feel like you need any more suctioning? No need? Okay, perfect. But if you did need any more suctioning, I would wait for 30 seconds before I hyperoxygenate you again. And I would do another round of suctioning where I test the suctioning and go in again, all right? So, okay. Now that that's done, I'm going to remove these gloves and replace your inner cannula. I'm going to do 20 seconds of hand hygiene here. Get a new pair of gloves. Okay, Miss Angeles, I'm just going to remove your O2 device one more time. Stabilize the faceplate again. Take this off. Okay, I'm just going to remove your inner cannula, okay? Hold it by the wings and remove it back, dispose it. And for the new inner cannula, I'm going to hold it only by the wings. Make sure it doesn't touch anything else. Okay, hold it like that. Then I'm going to go in. 1, 2, 3. There we go. Okay. Did you feel any sort of discomfort, Miss Angeles? Any pain? No pain? Okay. Any shortness of breath? No shortness of breath. Perfect. I'm going to remove the old dressing underneath the faceplate. I'm going to do a quick skin assessment. So I see that there's no redness, no swelling, no signs of infection, no skin breakdown, or any pressure injuries. Okay. Miss Angeles, I'm going to let go of the faceplate as I prepare the cleaning kit. Okay. So there's already saline in the kit. I'm just going to put 3 gauze inside the saline over here. Okay, and then I'm going to put 2 Q-tips in the saline as well on this side. Okay, now that they're wet, I'm going to take 1 Q-tip. I'm going to stabilize the faceplate. I'm going to swipe 1 time underneath the faceplate with a Q-tip and dispose. Another Q-tip, I'm going to swipe above the faceplate inside 1 time, dispose. Then for the wet gauze, I'm going to take 1 and I'm going to clean underneath the skin underneath the faceplate. Okay, it's all clean. Another wet gauze above the faceplate on the skin. Okay, all clean. Final wet gauze. I'm going to clean the faceplate itself. Okay. Then for the dry gauze, I'm going to just dry the skin above and below, and then the faceplate itself. Okay, it's all dry. Then I'm going to take this split gauze, I'm going to put it underneath the faceplate for you. There we go. Okay, Miss Angeles, did you feel any discomfort or pain? No discomfort or pain? Any shortness of breath, Miss Angeles? No discomfort or no shortness of breath? I'm going to put your O2 device back on. Do you have any questions for me at all, Miss Angeles? No questions? Okay, perfect. All right, I'm just going to dispose of everything I don't need anymore. So I'm going to dispose of this drape. I would leave the suctioning or the sterile, the saline and the sterile disposable container if I needed more suctioning. But for now, I don't need it, so I'm just going to dispose of it. Dispose of the saline as well and the Trach kit. Okay. Next thing I want to do, I'm going to have to change your trach stabilizer, but I need to call my colleague to come and help me and stabilize your faceplate for me. So I'm going to have to leave the room. So in order to do that, I'm just going to have to lower your bed, put in the lowest position, put your side rails up, and then have the call bell right next to you. I'm going to take my gloves off, do 20 seconds of hand hygiene, and I'll be right back, okay, Miss Angeles? Hi, Miss Angeles. I'm here back with my colleague, and we're both here to help change your trach stabilizer. So upon arrival, we have our face shield and our face mask on. We're both going to do 20 seconds of hand hygiene. Okay, and then we're both going to put a clean pair of gloves on. Okay, Miss Angeles, if you feel any sort of pain, please tell me right away. So first thing I'm going to do, I'm going to have my colleague stabilize their faceplate as I remove your oxygen. Okay, so there we go. Remove this here. Then I have your new stabilizer ready, so I'm just going to have this right here. We'll dispose of this and leave it right here. start removing it on this side first. Okay, I'm going to assess the site on your neck. So I see there is no signs of infection, redness, swelling, or skin breakdown or pressure injuries. Okay, I'm going to put this side of the trach stabilizer on. And have this go under your neck. Okay, now I'm going to stabilize the faceplate on this side, and my colleague is going to remove that side of the trach stabilizer. So upon assessing the site of the neck, do you see any sign of redness, swelling, signs of infection, skin breakdown, or pressure injuries?
No.
No? Okay, I'm going to dispose of this. Okay, now that the trach stabilizer is on, I'm going to put 2 fingers underneath the trach stabilizer to see if it's comfortable. Ms. Angeles, do you feel comfortable around your neck? You do? Perfect. Did you feel any sort of pain during the procedure? No pain? Alright, I'm just going to put on your O2 device. Okay, now that I'm done, I'm going to have my colleague, we're both going to remove our gloves. And then we're both going to do 20 seconds of hand hygiene. Okay, my colleague is going to leave the room. But before I leave the room, I'm just going to do double checking everything on your bedside. So for your bedside, I see that your emergency equipment is all available. And I see that your suctioning is right above your head. Okay. Did you feel like you tolerated the procedure well? You did? Alright, perfect. Okay. So I'm just going to do one last round of vital checking before I leave. So I'm going to do hand hygiene once again, and then I'm going to put another pair of gloves. Okay, Ms. Angeles, I'm just going to look at your vitals again. So I see that your vitals are all within normal limits. Your respiratory rate went from 26 to 16, which means it's decreased, and your oxygen saturation levels have went to from 89% to 98%. This means your lungs are working pretty well now. And are you feeling any sort of pain? No pain? Are you feeling any sort of shortness of breath? No shortness of breath. Perfect. I'm just going to take a listen to your lungs one more time. Okay, Ms. Angeles, can you inhale for me? Exhale, inhale, exhale, inhale, exhale, inhale, exhale. Okay. I don't hear any more abnormal lung sounds. Okay. So other than that, I think we are done. So I'm going to have the bed lower to the lowest position. I'm going to have the side rails up, and I'm going to have the call bell next to you. Do you have any more questions before I leave? No questions? Thank you very much, and Ms. Angeles. Okay, I'm going to remove my gloves. I'm going to do 20 seconds of hand hygiene, and then I'm going to document everything, okay? You feel like you tolerated the procedure well, Ms. Angeles? You did? Perfect. Okay, I'm going to go ahead and document, leave the room. Okay, I'm going to document the date and time of the procedure. I'm going to document the patient's tolerance level and their pain level during the procedure. I'm going to document their site assessment on the peristomal site and around their neck. There was no signs of redness, no signs of swelling, no signs of infection, skin breakdown, or pressure injuries. So when I was checking their vitals are all within normal limits now. Pre-procedure, their oxygen saturation level was at 89%. It is now increased to 98%. And their respiratory level has went from 26 breaths per minute to 16 breaths per minute. And upon listening to their lungs had signs of bronchi pre-procedure and post-procedure. It is now clear bilaterally. And earlier when I was suctioning their secretions, their mucus was thick and clear, and the amounts was moderate. And other than that, I'm going to submit my documentation, and I'm done with the procedure.